Have you ever had a feeling that your body might be trying to communicate something, but you couldn't quite figure out what it meant? What if something as subtle as a change in odor, like the scent of your sweat, breath, or urine, could be a warning signal for a serious health issue, such as cancer? It may sound surprising, but your body often gives off subtle clues, and ignoring them could result in missed opportunities for early intervention. Cancer is one of the most devastating diseases globally, and it doesn't always manifest itself with obvious symptoms, especially in its early stages. In fact, some of the first signs might come in the form of changes in body odor, whether it's in your breath, sweat, or skin. These scents, though often imperceptible, may serve as early alerts, subtly signaling that something is wrong. Would you recognize these warning signs? In today's video, we're diving into 8 cancer-related smells that many people overlook, clues that could be essential for detecting the disease in its early stages when treatment is most effective. This knowledge could be life-saving, so stay with us until the end to learn what you need to know. But first, give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Now, you might be wondering, how can cancer affect body odor? The answer lies in the metabolic changes caused by cancer. As cancer disrupts your body's normal functions, it often results in the production of unique chemical compounds, known as volatile organic compounds, VOCs. These VOCs can alter the way your body smells, and may be released through your breath, sweat, or even urine. Interestingly, research has shown that specific cancers, such as lung, skin, and bladder cancer, produce distinctive chemical markers that the body emits into the air. While these compounds are typically undetectable to human noses, certain animals, especially dogs, are able to identify them with remarkable accuracy. In fact, there have been cases where trained dogs detected cancer long before medical tests showed any abnormalities. Scientists are even working on developing technology to mimic a dog's superior sense of smell to detect these volatile compounds, and devices known as electronic noses could one day revolutionize how cancer is diagnosed. Imagine a future where a simple test, such as analyzing your breath or sweat, could detect the presence of cancer. While these technologies are still in development, paying attention to your body's subtle signs is crucial in the meantime. If you notice any unusual or persistent smells, especially ones that don't seem to go away, don't dismiss them. These could be more than just quirky or random occurrences. They might be signals your body is sending out, asking you to take action. Ignoring these early warning signs could mean losing valuable time in the fight against cancer when treatment is still most effective and survival rates are higher. It may seem surprising, but the concept of using scent to detect cancer is supported by scientific research. Your body is constantly sending signals, some visible and some invisible, in the form of odors. These seemingly minor changes in body odor could, in fact, be life-saving clues if recognized early. So, how do you know when something's wrong? What types of smells should you watch out for? In the next section of the video, we'll share the 8 most common smells associated with various types of cancer. By staying informed and recognizing these subtle changes, you can take action sooner, potentially improving your chances of early diagnosis and successful treatment. Let's explore these important signals together, because early detection is the key to saving lives, and your health is worth paying attention to. Let's begin with one of the hidden warning signs that could point to mouth or throat cancer. 1. The hidden mold-like odor, a warning for mouth or throat cancer. Mouth or throat cancer is a serious condition that often goes undetected in its early stages. One of the most surprising yet important signs of this cancer is a peculiar odor that can resemble mold or rotting wood. This smell is not coincidental, but rather caused by a combination of factors that occur as the cancer progresses. Secondary infections, tissue necrosis, the death of cells in the affected area, and the release of volatile organic compounds VOCs, from the tumors are key contributors to the odor. As the cancer advances, these compounds build up, generating a distinct smell. This unusual odor can be especially noticeable on a person's breath, making it something people around them may detect while talking to the affected individual. Unfortunately, it is often mistaken for poor oral hygiene or a dental issue, which can delay the decision to seek medical attention. This musty, rotting smell is commonly accompanied by other significant symptoms, such as persistent hoarseness or a change in the voice, difficulty swallowing, dysphagia, unhealing sores or ulcers in the mouth or throat, white or red spots in the mouth, unexplained ear pain. If you notice this unusual odor, along with any of the other symptoms, it is crucial to seek help from a specialist, such as an otolaryngologist or oncologist. Tests like biopsies, CT scans, or MRIs can help identify the underlying cause. Although mouth or throat cancer is a severe condition, early detection can greatly increase the chances of successful treatment. Therefore, never disregard changes in your breath or any other unusual symptoms in the mouth and throat. If you notice this persistent smell or experience any of the associated symptoms, act swiftly. The sooner cancer is diagnosed, the better the outcome for treatment. 2. The odor of decomposition, a red flag for colorectal cancer. Colorectal cancer, one of the leading causes of cancer-related deaths worldwide, often goes unnoticed in its early stages. This is partly due to its symptoms being mistaken for common gastrointestinal issues. However, one of the first signs of colorectal cancer that you may notice is a change in the smell of your stool, which can become much stronger, more persistent, and take on an odor similar to decomposition. This unusual smell happens because colorectal cancer disrupts the digestive process, leading to the release of toxins and gases that alter the natural odor of feces. Though it's normal for the smell of stool to vary depending on diet or medications, an ongoing, unexplained smell of decomposition should not be ignored. This odor is often accompanied by other concerning symptoms, such as blood in the stool, persistent abdominal pain or discomfort, unexplained weight loss, changes in bowel habits, like diarrhea or constipation. One of the challenges with colorectal cancer is that many of these symptoms, including changes in stool odor, tend to appear only in the later stages of the disease. Therefore, noticing changes in the smell of your stool might be one of the earliest clues before the problem worsens. If you notice persistent changes in the odor of your stool, don't hesitate to see a doctor. Tests like colonoscopies, stool analysis, or imaging scans can help identify any abnormalities in the intestines. The good news is that colorectal cancer has a high cure rate when diagnosed early. Recognizing changes in the body, such as an unusual odor, can ultimately save lives. The sweet, unpleasant odor, a warning for breast cancer. Breast cancer is one of the most common cancers affecting women, and while it can also occur in men, though rarely, many cases go undetected until later stages. One of the lesser-known unusual signs of breast cancer is a sweet yet unpleasant smell emanating from the skin or any open wounds associated with the tumor. This odor typically appears in more advanced stages when there is infection or tissue necrosis, death of cells, in the affected area. As the cancerous cells grow uncontrollably, they can cause local inflammation and infections, releasing chemical compounds that generate this distinctive sweet smell. This odor is often most noticeable when there are open wounds or ulcers on the breast, leading some people to mistake it for an ordinary infection or poor hygiene. However, if the odor persists, it could be a sign of something far more serious. In addition to the smell, breast cancer often presents other concerning symptoms, such as lumps in the breast or underarm, changes in the texture or color of the skin, abnormal discharge from the nipple, persistent pain or discomfort in the breast area. Ignoring these early signs could delay diagnosis and reduce the likelihood of successful treatment. Breast cancer has a high survival rate when caught early, so paying attention to changes in skin odor or the presence of sores is essential. If you or someone close to you notices unusual changes in the skin or odor in the breast area, seek medical attention immediately. By recognizing these subtle but crucial signs early, you increase the chances of successful treatment and improve the likelihood of a positive outcome. Early detection is key to fighting cancer, and your health is worth being proactive about. 4. Sulfur in breath, an early indicator of stomach cancer. Stomach cancer, also known as gastric cancer, is a silent and often aggressive disease that frequently goes unnoticed due to its subtle and nonspecific symptoms. One of the more unusual but significant early warning signs is a persistent sulfur-like odor on the breath, reminiscent of rotten eggs. This distinctive smell arises from improper digestion and the release of sulfurous gases within the digestive system. When cancer affects the stomach, its ability to process food efficiently diminishes. This malfunction leads to the accumulation of volatile sulfur compounds, VSCs, which are released into the breath, creating the characteristic odor. Unlike common bad breath, this odor is persistent and does not improve with typical remedies like enhanced oral hygiene, dietary changes, or over-the-counter treatments. The sulfuric breath associated with stomach cancer is often misinterpreted as a symptom of minor gastrointestinal issues, such as acid reflux, gastritis, or indigestion. However, when this odor persists, it should be taken seriously as it may signify something more severe. Along with the odor, other symptoms may indicate the presence of gastric cancer, including chronic abdominal pain or discomfort, a constant feeling of fullness, even after consuming small amounts of food, persistent loss of appetite, frequent episodes of nausea or vomiting, blood in the stool or vomit, often indicative of advanced stages of the disease. One of the greatest challenges in diagnosing stomach cancer early is the overlap of its symptoms with more common and less serious conditions. However, the presence of sulfur-like breath can serve as an important early clue, especially when accompanied by other gastrointestinal issues. If you notice persistent changes in your breath, particularly a sulfur-like odor, and experience related symptoms, consulting a gastroenterologist promptly is crucial. Diagnostic procedures such as endoscopy, imaging studies, or biopsies can help confirm or rule out gastric cancer. Early detection of stomach cancer significantly increases the likelihood of successful treatment. Treatments are more effective, and the chances of long-term survival are higher when the disease is caught in its initial stages. Paying attention to changes in your breath and overall digestive health could make the difference between detecting the disease early or in a more advanced, harder-to-treat stage. 5. The rotten meat odor, a warning sign of skin cancer. Skin cancer, particularly melanoma, is one of the most aggressive and potentially fatal forms of cancer. While it often manifests as visible changes to the skin, such as alterations in moles or the appearance of new lesions, a surprising and lesser-known symptom can be a distinct odor resembling rotting meat or decaying tissue. This smell is not merely unpleasant, it can serve as an important early warning of advanced disease. This characteristic odor is the result of necrosis, a process where cancerous cells die and decompose, releasing volatile organic compounds, VOCs. These compounds emit a foul smell that may become apparent in open wounds, ulcers, or skin lesions associated with advanced skin cancer. Such lesions often go unnoticed or are misinterpreted as minor skin injuries, delaying diagnosis and treatment. The areas most commonly affected by this odor are open wounds or sores that fail to heal over time, skin lesions in less visible regions, such as the scalp, back, or behind the ears. Because these areas may not be regularly examined, the presence of an unusual smell might be the first detectable symptom of a deeper issue. Adding to the confusion, the odor can be mistakenly attributed to hygiene issues, common infections, or reactions to cosmetic products. In addition to the smell, other key warning signs of skin cancer include changes in moles or skin spots, such as rapid growth, darkening, irregular edges, or new pigmentation. Bleeding or crusting of lesions, particularly without an apparent cause. Persistent irritation or itching in a localized skin area. Thickened or raised patches that appear unusual compared to surrounding skin. When the odor of rotting flesh is present alongside these symptoms, the urgency for medical evaluation increases dramatically. Melanoma, in particular, is known for its high risk of metastasis and mortality if not treated promptly. Early intervention is critical. Visiting a dermatologist as soon as symptoms are noticed can lead to a prompt diagnosis. Diagnostic procedures, such as a biopsy or dermoscopic examination, can help confirm the presence of skin cancer. The good news is that skin cancer is highly treatable when caught in its early stages. Treatments range from simple surgical removal of the affected area to advanced therapies for more extensive cases. Recognizing the unusual smell of rotting flesh as a potential symptom, combined with awareness of changes in skin appearance, could save lives by ensuring early detection and intervention. Both sulfuric breath and rotting meat odors are uncommon but important signals that your body may be sending when something is seriously wrong. Paying attention to these subtle but distinct changes and acting quickly to seek medical advice can make all the difference in catching diseases like gastric cancer and skin cancer in their early, more treatable stages. Always listen to your body. It could be whispering a message of life-saving importance. 6. Ammonia in urine, a warning sign of kidney cancer. Kidney cancer is a particularly dangerous and often insidious condition that can develop without obvious symptoms in its early stages. However, one of the first unusual signs that may indicate kidney problems is a distinctive smell in the urine, a strong, pungent odor reminiscent of ammonia. This odor arises when kidney function begins to deteriorate due to the presence of cancer. The kidneys play a vital role in filtering waste and toxins from the blood, but when cancer disrupts their function, harmful byproducts such as urea accumulate, resulting in the characteristic ammonia smell. While it's important to note that not all ammonia odors in urine are indicative of kidney cancer, as other factors like urinary tract infections, dehydration, or a high-protein diet can also alter urine smell. Persistent or unexplained changes in odor should be treated with caution. When this smell is coupled with other concerning symptoms, it is crucial to seek medical attention promptly. In addition to the ammonia odor, kidney cancer often presents with other telltale signs, including back pain, especially in the lower back or side, blood in the urine, which may cause the urine to appear pink, red, or brown, fatigue that doesn't seem to improve with rest, unexplained weight loss, often accompanied by a decrease in appetite. One of the major risks of kidney cancer is that many of these symptoms can be mistaken for less serious conditions, leading people to delay seeking help. However, the earlier kidney cancer is diagnosed, the more successful the treatment options are. Ignoring changes in the smell of your urine, especially when paired with other warning signs, could result in missing an important early opportunity for treatment. If you notice a persistent ammonia smell in your urine, particularly if it is accompanied by any of the above symptoms, it's critical to consult a healthcare provider immediately. Kidney cancer, when diagnosed early, offers a higher likelihood of successful treatment and recovery. 7. A metallic smell in the breath or sweat, a sign of blood cancer. Another unexpected yet significant indicator of serious illness is the presence of a metallic smell emanating from a person's breath or sweat. This odor is often associated with blood cancers such as leukemia or lymphoma. The metallic scent is produced by changes in the chemical composition of the blood, caused by cancer cells interfering with the production or breakdown of healthy cells. This disrupts the body's chemical balance, resulting in compounds that create the distinctive metallic odor, often compared to the smell of rusted iron or old coins. This odor can be particularly noticeable during excessive sweating or light physical activity, and is often subtle enough to go unnoticed for some time. Many people mistakenly attribute it to environmental factors, changes in diet, or hygiene practices, unaware that it could be a serious warning sign of blood cancer. In addition to the metallic smell, leukemia and lymphoma typically present with other symptoms, such as extreme fatigue that doesn't improve with rest, persistent fever, often without an apparent cause, frequent infections, including those that are unusually severe, unexplained weight loss, which occurs without a change in diet or physical activity. When the metallic smell is combined with any of these symptoms, it's imperative to seek medical attention as soon as possible. Blood cancers like leukemia and lymphoma can progress rapidly, but with early detection and treatment, survival rates improve significantly. If you or someone you know is experiencing persistent changes in breath odor, particularly a metallic scent, it's crucial to have it evaluated by a doctor. Blood cancers are treatable, especially when caught early, so don't ignore this potential warning sign. 8. The sweet, fruity smell, a warning for lung cancer. Lung cancer is one of the most dangerous and deadly forms of cancer, often developing without any immediate symptoms. However, in some cases, patients with lung cancer may notice a subtle yet distinct sweet, fruity odor emanating from their breath. This unusual scent is the result of volatile organic compounds, VOCs, released by altered cancer cell metabolism in the lungs. These compounds accumulate and are detectable in the breath, often resembling the smell of fermented or spoiled fruit. Unlike regular bad breath, this fruity smell does not disappear with typical oral hygiene practices and tends to persist over time. Unfortunately, this sign can often go unnoticed or be attributed to minor digestive issues, dietary habits, or even conditions like diabetes. However, when this odor is frequent and unexplained, it warrants serious attention. In addition to the sweet, fruity breath odor, lung cancer often presents with other key symptoms, such as persistent cough that worsens over time, difficulty breathing, even with minimal exertion, hoarseness or changes in voice, chest pain that may become sharper with deep breaths or coughing. Lung cancer can be one of the most challenging cancers to treat due to its tendency to be diagnosed at later stages. However, when detected early, treatment options are much more effective. By paying attention to persistent changes in breath odor, such as a sweet, fruity smell, you could potentially catch lung cancer in its earlier stages when treatment is more successful. As we've discussed, your body may communicate with you in subtle ways, such as through changes in odor that could be early warning signs of serious health conditions like cancer. These smells, whether sulfuric, metallic, or sweet, may seem insignificant, but they could be the key to detecting life-threatening illnesses before they progress too far. Listening to your body and recognizing these changes can make all the difference when it comes to early detection and successful treatment. If you or someone you care about notices any persistent or unusual changes in odor or other symptoms, don't hesitate to seek medical attention. Early intervention is a powerful tool in the fight against cancer, and taking action could save a life. Stay informed, stay healthy, and remember that your body is always speaking to you. It's up to you to listen. If you found this information valuable, we encourage you to give this video a thumbs up, share it with your friends and family, and subscribe to our channel, Healthy Life, for more essential health tips and potentially life-saving insights. Together, we can raise awareness and empower more people to take charge of their health. Stay informed, stay proactive, and prioritize your well-being. Thank you for being part of our community, and we look forward to sharing more with you in the next video.